and read the writing task. You're the charge nurse on the maternity ward where Rosalind Hinds was born and need to write a letter to the local community midwifery team outlining relevant information and requesting discharge follow-up. Address the letter to this address. Now let's read. So this is Rosalind Hinds, 6 days old. Her next of kin is her mother, Janet Keating. She was born on 2nd April 2021. Discharge date 8th April 2021. Diagnosis: low birth weight and opioid dependence. Will live with mother at maternal grandmother's house. Mother, 22 years, was heroin dependent for a period of 2 years. She is single and recently worked as a sex worker. Estranged from father of Rosalind has alleged domestic violence towards her during pregnancy. Janet's mother, supportive. That means Rosalind's maternal grandmother. Rosalind is the first child. Department of Community Services involved, but approve discharge living situation as long as they are with grandmother. Doctor will be forwarding the medication details. Coming to the management and progress during hospitalization, both mother and baby completed heroin withdrawal without complications. Baby was 2 kg at the time of birth. Now she is 2.3 kg. Bottle feeding erratically, maybe to do a low appetite. Poor bonding between mother and baby. Janet often needs prompting to care for baby. Drug and alcohol team involved in managing Janet's ongoing addiction issue. Right. Now this is the discharge plan. Daily visits until Rosalind, her weight is stable and her feeding is stable. Ensure safe environment for baby and update Department of Community Services if risk present. Monitor mother's coping and psychosocial state. Educate mother and grandmother on infant care. Liaise with drug and alcohol team to provide integrated support for mother to reduce risk of heroin use. Right, so drug and alcohol team involved in managing these two things. Liaise with drug and alcohol team. These two things, I think I will put them together maybe at the end of this letter. Alright, let's write this letter. So here we do not have a recipient's name. Let's write the address. Community Midwifery Team, Maitland Maternal and Child Health Center, Maitland. We leave a line. Today's date. We leave a line again. Salutation. We don't have a name here and we don't have a job role neither. Let's write, dear sir or madam. We'll leave a line again. RE section. Rosalind Hinds. DOP. That's 2nd April 2021. Right, now let's write the introduction. I'm writing to introduce Rosalind, a 6 days old infant who was born to an opioid-dependent mother. I am writing to introduce Rosalind, a 6 days old infant who was born to an opioid-dependent mother. Both the baby and mother are being discharged from hospital today. So that completes our introduction. Now let's write our first body paragraph. So in this paragraph, we will detail about Rosalind's progress during the hospital stay. In fact, Rosalind and her mother's progress during the hospital stay. We'll start with her birth weight. Rosalind was born with low birth weight. Let's write here 2 kg. Now, it's okay to put brackets sometimes, not much, maybe once or twice, to be more clear, which has gradually increased to 2.3 kg. The baby was not consistent with bottle feeding, probably as a result of decreased appetite. Rosalind's mother, Miss Keating, needs frequent prompting to care for her baby. There is poor bonding between them. Both the mother and baby have completed heroin withdrawal without complications. That's perfect. That's it. So this paragraph is all about the progress of their progress during the hospital stay. Right. Now we make a new paragraph, and now it's quite important to set out a background for a mother, for Miss Keating. As the reader, we need to give an idea to the reader about Miss Keating's background, family support. Miss Keating is here it's given Rosalind is her first child. Miss Keating is a first-time mother, and okay, let's combine this with her heroin dependence, and has a 2-year history of heroin dependence. Right. She is a single lady. She separated from the baby's father due to domestic violence during her pregnancy. Grandmother supportive, right. Rosalind's maternal grandmother is supportive. So that's it. So this paragraph is all about Rosalind's mother's background. We set up a background for Miss Keating, and this will give an idea to the reader about her background, about her family support. Now, what's left after discharge? Now, let's come to the discharge detail and the post-discharge care. After discharge, Miss Keating and her baby will live with grandmother. Okay. The discharge was approved by Department of Community Services. Now, I could have removed this Department of Community Services, but in the discharge plan, it is given like the department needs to be updated if there are any risk. So I have to write this as well. Please ensure the baby has a safe environment and update the department in case of any risk. Please arrange daily home visits until Rosalind's weight and feeding become stable. Miss Keating's coping and psychosocial state need regular monitoring. Coping and psychosocial state need regular monitoring. Right. We also ask you to educate both the mother and grandmother on infant care. That's right. Now, like I said, about the drug and alcohol team, about their involvement, and about the need to liaise with them. These two things, I can combine them together and write it at the end of this letter. That depends on how we present the information. That totally depends on how we present our information. For me, I felt it would be better if I could combine these two things together and write it at the end of this letter. The drug and alcohol team has been involved in managing Miss Keating's drug addiction since hospitalization. Please keep in touch with the team for providing her integrated support to prevent relapse. Rosalind's doctor will forward the medication details to you. If you require more information, please contact me. Yours faithfully, Charge Nurse.